It's just beautiful. You explain what I lived there and I experienced there as well, Emma. So I have your book and I did took your book with me in Brazil.
Oh,
And I was reading through when we went to Palmelo, I was reading the part of Palmelo and the spirit, and that's what I experienced in the hospital as well. Being a mental health nurse in Australia, I was aware to see how the treatment of the patients and the outcome they have is extraordinary.
thank you. Thank you. One of the things that always amazes me is walking through the psychiatric hospital in Goiania with the president, who oftentimes walks with us and shows off the hospital in many wards. But the patients will walk up to him and he has no fear. And oftentimes the patient will just reach out and give him a hug and a kiss.
Yep.
I haven't seen that going on in the hospitals in the United States.
And even here in Australia, that was one of the things that I was with the director of nursing, and the patients who come to her like she was well known, and they come not well known in famous, but well known to them. So they'll come and talk to her like they're talking to a friend.
Yes.
I'm going home and that's what's going to happen to me. And the friendly, and just for I forgot to say something for the mediumship part, what I saw in Palmelo and at the psychiatric hospital in Goiania, if you imagine a half circle of energy through the town. So I felt that in Palmelo, the whole town was just blocked with a hole of energy. And the same I saw in the hospital. It was just incredible from the spiritual medium point of view.
Yes.
And I've been a nurse for 35 years. I've never been in a psychiatric hospital like the one in Goiania. The tranquility, the calm, the love, and the connection the patient has with the nurses, it was impressive. Another important thing it is to work in a psychiatric hospital in those spiritist psychiatric hospital, you do not need to be spiritist. You need to be inclined to work with them with the normal Western medicine, but it is not a requirement. So I actually met the director of nurse who was not, she was Catholic, and I met the director of HR. He was Catholic as well, but they're sympathetic and they've been studying for curiosity is not a requirement. The requirement is fraternity, is giving to others what would you like to give to yourself.
I was intrigued with what you said about the treatment being free in Brazil, but I'm curious to know how much did you spend to get from Australia to Brazil?
About $6,000. But remember, I have family in Brazil. So I have family in Goiânia. So I stay with my cousins in Goiânia. And then at the hotel where I stay for 6 days, it's about 40 American dollars a day, something like that, 40 to 50. So that cost with your accommodation and the food, the whole 5 food a day. So breakfast, morning tea, lunch, afternoon tea, and dinner.
Thank you, Helen. Another little point of interest is 20 or 30 years ago, when my first book was published, Eternal Life and How to Enjoy It, there was almost immediately a Brazilian translation commissioned, and it came out in Brazil. So, of course, that got me some Brazilian fans who said, Gordon, come and visit us. Please come and visit us. And I had to explain to them I couldn't actually afford to come and visit them. So to me, there's all these interesting things that happen internationally, but only if you can afford it. Yeah. So anyway, I don't want to be complaining. I just was curious to see what you spent. So thank you for that.
It's okay.
Thank you. Louis and Livia, do you have any questions from Helen before she has to go?
Oh, yes. No, very good. Helen witnessed everything we've been witnessing for the last 50 years in Brazil. The case Emma talked about, Marcel, is a case of hundreds of people I've seen, right, that were stuck in psychiatric hospitals due to the beliefs of their families, religious beliefs, but now are outstanding mediums, outstanding lecturers on Spiritism, and this is something that, and I have to thank Helen for her testimonial, and Emma was amazing. I think I had never seen a person from abroad speaking so comprehensively and so well about the postulates of Spiritism. It was very well done, Emma. Thank you so much, right? You did a very good job. Thank you, Helen, too.
Thank you.
Tell us a little bit about the students that you have with you at the moment that are watching this.
Yes, 2 of them are here today. 3 of them are here today. And as I told you, they were doing a training course. They were, this is Louisa and Peter, actually a boy and girlfriend. And Lida is there too. I can see them. And they all of them, they had some experience in the hospital, André Luiz, here in Belo Horizonte, right? Because they're medicine students, so at a certain point, they had to do a training course linked to university, and they go there and they did, right? And there's lots of things. I'd like to tell you a little anecdote. I remember my mother, she was working with a medium back in the 1970, late 1970s, and there were 3 doctors from the hospital under in my mother's Spiritist center. You know, doctors are always a little bit more scientific, a little bit more skeptical, you know, and the spirit that was coming through the medium was of he presented himself more humble, in a more humble way. He was more, and then the spirit turned to the spirit that was manifesting through the medium, turned to the doctor, said, "You don't believe exactly what's going on here. You don't believe I am a spirit coming through the medium, do you?" Of course, the doctor said, "No, you're a spiritist. We do believe you." "Okay, but I'm a simple person. I think you don't believe I have some wisdom to tell you." "Oh, come on," the doctor said. "No, it's not like that." And then the spirit said, "That patient, that 17-year-old patient you're treating at the hospital, her problems are not in," and then she said that a technical, I think the afferent cells, it was in the efferent cells, something like this. The doctors were amazed. It was a jaw-dropping situation. They took note of and then they left the room saying, "My goodness, the spirit has just given us the solution to the situation." When the doctors left, my mother, "Hey, Spirit, but you're such a humble guy. You speak so simply. Why are you like this?" He said, "I am a doctor here in the spirit world, but my medium, he believes me that I am a very humble person, and if he can only accept my manifestation if I present myself to him like this." So it's a cultural problem, right? So it was very funny, wasn't it?
Fascinating, Louis, fascinating.
I think they can talk a little bit.
If you want to ask Pedro and Luisa about their experience in the hospital, you can talk, and Leda too, right?
Yeah, let's hear from them. What I'm fascinated is the situation changing so that medical students generally are exposed to this?
Well, they can.
Nada vai falar.
Oh, okay.
Hi, everyone. Well, unfortunately, I think this knowledge about Spiritism is still limited to very few people, and our colleagues, they do not have this knowledge and this perception. As Helen said, a lot of our teachers in André Luiz weren't even Spiritists. They were Catholic, or they didn't believe in God at all. But for me, it was a very pleasant experience to see that everything we study is applied somewhere. it was the first place that I could see medicine and spiritism walking together. And I think it was hopeful. It gave me hope that someday other services could apply that knowledge too. And it was very different from the other hospital experiences I had. And the physical problems weren't the main focus. And so the place there, the contact with nature, the musical therapy, other activities the patients have there that I think from what I could see make a lot of difference. And even if it's not talking about spiritism at all, taking care of this other part of this mental, and it made a great difference for them in their recovery process.
Hi, everyone. I'm not a medical student. I'm a lawyer, actually, but I've been at André Luiz Hospital for a year in the counseling part as a spiritist that I am. And because they do have this support activities, like Luisa was saying, which is counseling and the spirit release meetings, right? So there was one particular experience that I remember very well, and it was very well treated there, which was a lady who had a relationship with a priest, a sexual relationship with a priest, and he didn't believe in contraception. So he made her have abortions, and she had like 7 or 8 abortions. And that was driving her crazy because it was not only that she suffered all the process of being pregnant and everything, but that as a spiritist, I could tell her that she was being influenced by this spirits that wanted to reincarnate and were being stopped, they were being violently taken away from her. And someone had to tell her that because she didn't believe that. So someone had to and doctors sometimes they wouldn't say that because not all the doctors believe in that. So the hospital has these other ways, other means that are also that are also a therapy for the patients, right?
Fascinating, absolutely fascinating. Thank you, Emma.
Yeah, Wendy, I would like to mention something to Gordon because I've been thinking about how difficult it is for people who are very enthusiastic about what they hear about Spiritism, and then just find that traveling there is just too much. It's very expensive. The travel is. Maybe living in Brazil or visiting there is not as expensive as some of the other countries, but traveling can be expensive. And I do have a sense of mission in my life, and one of the missions that I have is actually helping people to understand what this paradigm of care is about so that they can bring it to their own country and begin to spread what it's about. That's why I put a picture of a spring on the first part of my show tonight, the PowerPoint. So I don't think it's necessary to actually go. I think, hearing about it, reading about it, that is the first step in terms of bringing it into our culture. And thankfully, we now have things like energy work that are being used in some of the hospitals. I live near one of the hospitals that has the greatest reputation in the United States, which is at Dartmouth College. It's Dartmouth Hitchcock Hospital. and they are allowing Reiki treatments. And, you know, I seem to attract people to come who want to come on the seminar that I give in Brazil. And some of them are psychiatric nurses, and they tell me stories about being able to do something like spirit release with patients. This is before they went to Brazil. So they were doing this in the United States, and they did it underneath the radar, as it were. So they were not talking to people that they were doing spirit release with the patients, but the doctors were coming to them and saying, I don't know what you're doing. You're doing something with the patients because they're getting better. So would you please go into room XYZ right now? And just don't tell me what you're doing. Just do it. So, you know, it may be very risky in certain circumstances to bring some of these practices into more conventional setting, but it can be done. And I'm not suggesting that people do things that are illegal or are going to get them into trouble, but I am suggesting that we're in a time of huge transformation. And speaking about the psychiatry in the United States and what's going on with mental health, we're in a period where it's very clear we're at a loss. We don't know really what to do and how to help people other than give them meds so that they don't have to feel as bad for a period of time. But over the long term, that's not really, it's proven to be not the best solution. So, you know, those of you who do not want to travel to Brazil for financial or other reasons, I think it's time that we get together and move this kind of paradigm into our lives.
Yeah, I just want to mention comment what Emma said. The psychiatric medication not only don't help 100%, as well as, which bothers me a lot, is the side effect. So what I experienced here in Australia is a terrible side effect of the medication. Yeah, the patient, it might improve from the hearing voices, improve a little bit their function, but there's still a lot of function are impaired by the side effect of the antipsychotic or most of the psychiatric medications. In Brazil, because they use a very small dose, so the dose they use in Brazil is much small in comparison to what we use here in Australia, and I believe the same in America, the side effects are much less. So therefore, the patient has a much higher functioning, as well as they have the opportunity to train in their mediumship or to train in their spiritual healing powers, or to training themselves to understand why they got sick. So the recovery is much more broader than what we have in the conventional psychiatric institutions nowadays.
I want a question for Emma. Emma, I have such adoration and respect for you. I don't know if you know this, but you know, the class I took from you was very, very helpful. And I am now a practicing medium. So, and I'd asked Emma to give me some thoughts about what she thought I could do with my many experiences that I had, and we had that conversation. But what I'm interested in, Emma, is, you know, I know you've taken quite a few practitioners from Great Britain, from the United States, and I think other European countries as well, to the Spiritist centers. And I'm curious because I have worked in the peer movement, working with others like me who are having these experiences, getting drugged, diagnosed, past pathologized, locked up, all of those things. And many of us have very similar sets of information coming through. Is there a way that the practitioners that you have worked with can work with peer kind of lived experience folks who are also mediums? Because this is something that's so intriguing to me. I'd love to get involved in this work in helping those who are experiencing what I affectionately call excursions into anomalous experiences. What is your experience now with having these practitioners come back and working this understanding into their practice, and perhaps working with people who with lived experience who can also support the process?
So, Ellen, I don't remember what course you have taken at IMHU, and so forgive me if
Let me tell
I.
you what it was, because it was great. It was integrating anomalous experiences, integrating spiritual emergency. You taught it with a man who was working with people who were doing the drug-assisted experiences, and I've not done drug-assisted. I had several anomalous experiences without.
Okay, I think it was a support group that you participated in, and I taught that along with Kyle Buller.
Yes. Yeah.
So to answer your question, one of I look at the 46 courses that we now give at Integrative Mental Health University and say, well, what is it that we're really offering that is different than what other people are offering? And certainly the 7-day seminar to Brazil to learn and to experience the what is offered at the Spiritist centers is one thing that's unique. Nobody else is doing it. But the other thing that I've just learned is really quite unique is the 5 online webinars on how to effectively support someone in spiritual emergency. And if for those of you who aren't familiar with that term, spiritual emergency, you could, excuse me, consider that Marcelo had absolutely no conceptual framework that was supportive or positive for some of the experiences he was having. So when he started hearing voices, he thought, oh, that means I'm a lunatic. And the psychiatrist that his parents sent him to also said, yes, that's right. You are likely psychotic right now because you're hearing voices. But for another way of looking at it is that he was actually opening up his psychic gifts, which I think, Ellen, you were talking about, and it can be very disorienting, especially if you have no conceptual framework for what that is all about. You don't know the language, you don't know how to talk to yourself about your experiences, you don't know how to talk to others about it, and you're suffering because you're having these big experiences and have no idea what's going on. So at IMHU, we actually train spiritual emergence coaches. I've trained over 130 of them around the world, and they are available for assisting people who are like Marcelo, who are having big experiences. And a lot of them know, I'm not going to a psychiatrist, they say, because I know what's going to happen. So it can be actually something that someone had already experienced. I have a nurse that recently got certified as a spiritual emergence coach who was practicing as a nurse for 20 years, and then she had a huge spiritual opening, and her family got very scared and said, you have to go to a psychiatric hospital and you have to take drugs. She took them while she was in the hospital, which was 5 days, and then immediately stopped. And she's got tremendous empathy with those who are going through psychic opening, who recognize for the first time maybe that they have mediumship abilities and they need to get training. And so there are a lot of people who I've trained who are peer counselors and peer coaches, as well as people who are licensed therapists and psychiatrists. And so that's exactly what they're learning, Ellen, through the course, is how can we effectively help those who are opening up to these tremendous gifts and that unfortunately are not recognized right now by conventional psychiatry as a large institution that it is. So there are people, of course, that do recognize it, but they're few and far between in terms of psychiatrists who understand this.
Thank you, Emma. Now, just let me flag that Emma is coming back on the 24th of August to talk about spiritual emergency and the Integrative Mental Health University. So write that one in your diaries. I think many of you will find that particularly interesting, and she'll be talking about, because it does obviously affect those of us who are working with developing mediums. And I don't know if some of you might know George Anderson, one of the best mediums in the United States. When he was 18, he was dragged off to a psychiatrist, and he was this close to having shock therapy because he was hearing voices. So yes, and unfortunately, it still happens with people who have near-death experiences. We often hear about people being dragged off to psychiatry. So this is what I'm so excited about about the psychiatrists in Brazil who are much more aware, those who are much more open to this sort of thing. So, and there's quite a few of them who are quite big in the spiritualist movement, or sharing about evidence for the afterlife. Daniel.
Sorry, Wayne, I'm just going to say goodbye to everyone. I need to go. Thanks so much for inviting me.
Oh, Helen, thank you so much for coming.
See you. Bye.
Lovely. Bye for now.
Thanks, Helen.
Okay, Daniel.
Yes. Well, Emma, thank you so much for your wonderful presentation. Alex's painting, the first painting that you showed, reminded me of a situation years ago. I was staying in London, the home of a friend. He had a haunted room in his house. I discovered this independently of his even telling me about it. His room was a painting studio. And when he, Malcolm, my friend, was in that room, he would obsessively paint these paintings that looked very much like Alex's first painting, the before painting.
Mm-hmm.
And this leads me to the question of, does Spiritism engage in the exorcism of physical locations?
Oh,
do they acknowledge that there may be a trapped spirit that may be affecting the individual's psychological or psychiatric situation?
I think I can only answer that by saying that it depends on the people who are part of the Spiritist centers, because most of the activity that goes on in terms of assisting people on a spiritual level with their healing takes place within the walls of the center with a group. In other words, it's not one particular individual who might go to someone's home or go a certain place with a person, or even, have a Zoom call with them. They always work in groups. And generally, they work in a place that is also blessed with a great deal of protection. So I've been sitting in on some meetings with mediums where they're actually blessing and clearing the whole hospital, as well as all the wards in the hospital. So clearly there's a notion about location being extremely important. And I've heard discussions about how a hospital was being attacked by negatively motivated entities. So there's a clear sensitivity to it. But if you think about a group of mediums then going out to someone's home or location, that's a pretty rare event. It's not generally thought of as just part of what everyone does. And Luis, if he's still here, might have a different perspective on it. But I
think he's had to go.
Oh, okay. I would just say it's unusual, but it's not out of the question at all. But an important thing to remember is that within the Spiritist tradition, generally the mediums work together in a group, not alone. And they do not like to have one medium as being like the most authoritative medium. And that's one of the things that tipped me off that John of God Center was not Spiritist.
And that makes a lot of sense. Makes a lot of sense. Thank you.
You're welcome. Thanks for the question.
Sherry?
Yes. Can I get the name of one of those coaches? Because I have a little cousin. He's 50 years younger than me. He's an amazingly gifted medium. He can just have a kid bother him and he'll call me up and I'll go to the prayer registry and he'll start describing a child. The problem is that as gifted as he is, he's been with shrinks since he was a kid. His family, he won't tell them, he can't come out of the closet, and he'd be very upset if I gave his name. And yet I'm telling you, he's so gifted. And I'm wondering, when you mentioned those coaches, Emma, that help people in that state of mind, he is in that state of mind, and they have him on a lot of strong drugs. I mean, stuff that, they just don't get that this guy's gifted. And I'm the only one he can talk to who, knows what he can do, but he's terrified to even discuss it with his parents. I'm not allowed to. I'm like under silence. So can I get the name?
It's a very complicated situation. I'll tell you what, Sherry, I will put in the chat box how to get to the international directory of spiritual emergence coaches, and that can benefit anyone here. And by the way, Louise, do you feel comfortable speaking? Louise Mustard? You're muted, Louise. So I'm calling on Louise because she's taken the courses. She's a spiritual emergence coach and facilitates some of the group meetings in Australia.
Oh, wow.
I facilitate the meeting of coaches who we meet once a month to sort of educate ourselves, catch up with what's happening, keep in touch with things, but also we are kind of like a peer support group as well. But we have had, I don't have one at the moment, but we have had support groups in Australia, here in Perth, which have involved 2 coaches running a kind of monthly meeting or whatever, and having people turn up and bring a plate of food. So there's no cost and, we've kind of put it out there for people who are in a position where they struggling with a sense of overwhelm, with not really being able to integrate experiences, and we did get quite a few people. We had a group going for quite a while here, and we witnessed people going through experiences that could either easily have been pathologized and had to some degree been, and they could have ended up being on medication, could have ended up going in so many different ways, but actually through the group process and through being able to normalize their experiences or just express them and get different perspectives, what people began to realize was that they weren't their conditions, that they were actually, I think probably if I saw a single common thing, it would be that people were tended to be able to distance themselves from the things that have been happening to them and see the life patterns in better perspective through the discussion with other people. So I think most of the people who came through those groups actually came through them and then left and are still occasionally in touch and are doing fine,
See, this boy is in the States. And
sorry?
Would you ever consider doing an online group? Because unfortunately, he's here in America and not going to be traveling to come, to your country.
Yes, it's possible. But also everyone works differently, but I tend to have had people contact me from overseas, and we line up a time to have just one-to-one communication, and that's been helpful for people, particularly in a time of crisis, just to have someone. And in those cases, sometimes I've had also like another key friend or relative who I'm also in touch with, so that we can support that person. That's happened a couple of times.
Can I get to reach
sorry?
Can you put your email address in the chat, and I could email you if I could.
But also, Emma, on the IMHU directory, there are a number around the world. So you may find that looking on there, and everyone has a different kind of background too. So reading those, you might find someone who resonates with you particularly, and who might even be local as well. So that's something to think about too. But I will put it in there.
Thank you.
Thanks, Sherry. Lloyd?
Yeah, responding to Dan's question, which I think Louise would probably say a similar thing, but I can't speak for him. I've taken courses from the International Academy of Consciousness, Nancy Trivelato and Wagner Allegretto, and they include dealing with place, cleaning the energy in your, especially where you sleep. It's actually quite a large part of their program. So, and they're from Brazil and have a Spiritist background in that sense. I mean, not just that they're from Brazil, but yeah. So I just wanted to put that in.
Thanks, Lloyd. We've had various speakers from the IAC over the years, and they're a very worthwhile organization. If any of you want to check out International Academy of Consciousness, they have amazing courses and amazing people. So they're definitely a great learning exercise. Does anybody else have a question for Emma? Regina, we haven't heard from you today. But for those of you who don't know, Regina is a wonderful medium and channel. And I know she's done a lot of work on everything. Regina, would you like to just perhaps tell us your opinion on what's Emma has shared with us?
I think it's fabulous what Emma presented and what Helen presented. I wish this was global, because if it were, it wouldn't be so hidden. People wouldn't have so much fear of the unknown. But, it's just, hopefully the emergence of the internet, frankly, that more and more people are becoming aware that they are not alone. They're not crazy, that, they might be hearing voices. I had the good fortune, fortunately, when I was a child, I was about 8 years old, when Spirit told me I couldn't talk about this. I couldn't talk about the voices I heard. I could express what I was seeing or experiencing or share little pieces, but I couldn't talk about it until Spirit told me when it was okay. It wasn't that I lost anything. I just couldn't say anything. And I promised it. And so from the time I was 8 till the time I was 22, and when Spirit came through and said, okay, now's the time we can start really learning and talking about it, and you can start experiencing things. So I wasn't put away or locked up or had drugs, although later on, when I had conversation about it, there was that she's crazy, and my sisters and brothers really wanting me to stop, shut up, don't say anything, don't hold a conversation, keep your mouth shut. So, you learn, but I trusted Spirit. And so when Spirit said to me, now's not the time, or now's the time, I could approach certain people, I really listened to the guidance of the Spirit. So I didn't have so many. I think I would have gone crazy otherwise, but I was able to keep the secret. And that was the most important thing I've done in my life, I think, besides getting married and having my kids and stuff. But it's, you know what I mean? It's just very interesting. And I know Ellen has had all sorts of experiences because she did see, she did talk, she did tell. And so therefore she was locked up. She was drugged. She was. Because I have cousins who really could experience these things, and they were sent away.
Well, I have to say, in your defense, Regina, that you're crazy good as a medium. Just crazy good.
Oh, you're sweet. Thank you.
Emma, I was wondering, there probably isn't, but is there any research about the effect on the crime rate of all of these clinics in Brazil?
Oh, I wish I knew the answer to that. I don't believe there is anything. you know, my dad was a researcher, and I worked at the National Institutes of Health and a leader in his particular arena of pathology. So I have a certain part of me that is quite curious about research. and I asked myself at some point, if it's so good, why isn't there more research? There could be all kinds of research about the effectiveness of these programs in the Spiritist centers, in the psychiatric hospitals. What's going on? Is there something that I don't see that makes it just not worthwhile? And then it came to me. It became extremely clear one day, and I thought, okay, so if there's, let's say, a Spiritist psychiatrist's office, and someone, two people come and knock on this person's door. One person is a researcher who is intent on getting the research out on this totally wonderful paradigm and securing the interest of the psychiatrist. And the other person is suffering. They may be depressed, they may be hearing voices, something's going on, but they feel disoriented and they really need help. The psychiatrist will choose the person who needs help if they're a Spiritist. Now, that's not necessarily so in the United States. Likely, the person who would be given attention is the researcher, because we're so enamored with research and proving things on a materialistic level. But the Spiritists that I've known and consider as part of my circle would clearly always choose to help the person in need rather than help the researcher. So I don't think that means that Spiritism is bad or wrong. It just means that's their priority, and we might learn from that. And I'd love to see more research, but I follow the people who are most active as researchers, and I haven't seen anything that would parallel what you're speaking about, Lloyd.
Yeah, I would think that there's not enough numbers yet in the population to really do a good study as well.
20 to 40.
Oh, okay. Yeah. Well, I guess I'm wrong there. Right.
First, I just want to say how wonderful this is to hear about. I had no idea that this was going on. This is fantastic. My own first experience was in the 1980s when a guy who's 30 years in a hospital, and clearly he'd opened when he was like a young lad. So he'd just been diagnosed and had his whole life. I'm sure he died in hospital. So that's quite emotional. So I'm wondering about how you're relating to children. What's the is this work being done with children, or how does that work? And also, just one other thing, just a suggestion that it's not just mediumistic abilities, it's magical abilities more broadly, perhaps, also. Thank you.
Thank you, Andy. Emma?
I think that question is for me. Is it?
Yeah, it is, Emma.
Yeah.
Yes.
So,
yeah.
Could you define a little bit more what you mean by is this work being done for children?
Well, I mean, when the work that you're talking about, I came in late, sorry, so I didn't catch the history of it all or the numbers or whatever, but you gave some large numbers of, I don't know what you call them, hospitals, you showed an office, that work, people that are going through an emergence, need support, might be, close to being diagnosed, medicated, all the rest. So, a lot of us, a lot of people open as youngsters, and so that's when the system gets them. So I was just wondering how, if the work is being done with children as well as older people.
Thank you.
Because I imagine that would be a very tricky area. That's why.
Yeah.
It's quite important because the most talented, I think, I might be, in my sense of things, is the most talented mediums and magicians, you know, it's through life. It's not particularly an opening when they're 18 or 29 or so, you know, like it's born, you know, it's natural. So it's happening from young, and most people can handle it. You know, they just keep quiet, perhaps, or they have some family support, but some people, you know, they can't handle it, and it's
right.
Yeah.
So, Andy, the two photographs that I showed of people who were instrumental in the hospital in Goiania, Gesiel Ramos and his sister, Dagmar, they both grew up, in other words, as children, right from the get-go. Their parents were spiritists, and they
Right.
were mediums coming in and out of the house all the time because their parents were leaders in the Spiritist movement.
Mm-hmm.
So I've heard Dagmar tell her story several times, and she was a medium from a very, very young age and experienced a lot of support for it and guidance, which would be extremely important for a child. Well, I think it's important for people of all ages, but especially for children who are trying to learn how to get along in the material world that we're all part of, as well as relate to what we would call our invisible friends, or those beings who are on the other side without physical bodies. And some of these children, Dagmar has related this about her own life, couldn't tell the difference. In other words, they would see a spirit as just as real as a physical human being. And so it could be extremely confusing for them, especially if they were confronted with someone who denied that reality.
Hmm.
And, but then on the other hand, just to grow up with that sense of, well, how do I know what's what, you know, and who's who, it can be challenging. So there's a wonderful film by about the life of Chico Xavier called Chico, and it literally relates how he had that particular issue going on, and when he was in his, I think he was just in his early 20s, and he had to have a job in order to afford just life, you know, food on the table. He went in to have an office job, and people would come in to give forms to the government, and he was supposed to take care of it and file it in the appropriate way. And there were beings that came in that basically were not human beings. They were beings out of the body, and he couldn't tell the difference. So the film, in a pretty humorous moment, actually shows him talking to the secretary and figuring out what kind of sign she could give him so he could then act appropriately, whether the person was a human being or not. So anyway, that's just one complication. I think he was fortunate enough, Chico was, to get support from Spiritists when he was in his teenage years. But he also had some difficult experiences when he was younger. And there aren't a lot of parents on the face of the earth, if we think about statistics, you know, and what percentage of parents would really be able to guide a child who had this kind of opening. It could be extremely challenging, and maybe it is right now, because more children are coming in right now who are more psychic than their parents and possibly brilliant in their psychic abilities. And so what are the parents to do? And where do they turn? So within Spiritism, there are institutions, there are groups, lots of them in Brazil. And if parents, let's say in this illustration, were to go to a Spiritist center and say, you know, can you help us with our child? We want to be supportive, but we don't know how to do this. Our child is talking about things and we can't see what the child is talking about. We can't figure out what they're hearing. We don't know if they're crazy or not. How do we care for this child and be supportive? They can get that kind of instruction and support at a Spiritist center. But
do you see that happening?
Yeah, yes, it definitely happens.
Yes,
Definitely.
thank you.
I've heard that from
Wonderful.
Louis.
Yeah.
Right.
Pardon me.
And within the Spiritist Center, the larger ones, they have classrooms for kids all the way down to kindergarten. And so again, they aren't trying to proselytize. They aren't a cult. They aren't trying to, get more members, make people pay a lot of money. They're not doing any of that. But they are creating a space where it's okay to have these kind of gifts. And if someone does have the gift, let's say a young person in this conversation, then that child has someone that they can go to where it's safe to talk about and they can get guidance.
So they're in this sense, they're like operating as training centers as well as facilitating support and community.
Very clearly.
Are there many of these larger places? How large are these? The large ones? Are there many of them?
Well, everything changes, right?
Yeah, okay, yeah, right. Yeah.
And so it'd be very hard for me to say, but you said you came in late, and what I mentioned is there are about 13,000 of these centers in Brazil.
Yeah, I caught that number, but like many could be very small. Yeah.
And some of them are quite small and some of them are very large. So anyway, it changes in terms of the finances and all kinds of things. People are born, people die, administration changes. So I can't say more than that. But yes, of course, they're looking at being supportive of children, sorting out things for themselves, figuring out, why am I here on Earth? Ready for that. And giving maybe some suggestions, but not proselytizing or indoctrinating. I think that's really important for us all to recognize and acknowledge.
Can I carry on another question?
Another question. Yes, you can, Andy.
Yeah, just a language question, really, because I guess this is basically Portuguese. So I don't know, is Spiritism spread through Spanish America? Is it coming up into United States? Is that kind of, because I'm English, obviously we have spiritualism, but not this, I haven't, we don't have this kind of,
actually, there's a very large Spiritist center in London.
Oh, is there?
I have visited, I've spoken there. Yeah.
Okay. I mean, I don't live in England anymore, but I'll go.
Anyway,
is it easy to find it? If I can do Google the address, can I easily?
Likely, yeah.
Okay, I'll do that. Oh, wonderful. Thank you very much.
Yeah. So
there are Spiritist centers all around the world. Even in Australia, we have them.
I'm in Turkey.
Oh, Turkey. I don't know about Turkey. Maybe not there.
Okay, thank you very much.
Allan Kardec, the one who wrote the foundational books, was actually a Parisian. So it started in Paris.
Yeah.
And has gone out from there. And there are 70 Spiritist centers in the United States.
Thank you.
Yeah.
Anyone else have it? Sorry, Emma?
Wendy, I just wanted to say, somebody mentioned that, yes, Spiritists have done research. And I'm very sorry if I gave the notion that there are not people who are doing research. In fact, one of the slides I showed you was actually myself standing next to two people who were doing research, and one of them publishing about 230 to 240 articles. So there is absolutely research going on, but the Spiritists have their heart into helping people. And so I just wanted to make that point. They aren't as, let me say, they aren't as concentrated on research as we are in the United States, at least.
Thank you. That's a very good point. And Emma, it's been wonderful. And of course, we're going to be talking with you again in a few weeks' time.